Miss SK was a 35-year-old working in a multinational company in Kuala Lumpur. She was experiencing persistent low mood, irritability, poor sleep, and difficulty focusing on her work after a separation from her husband. She was repeatedly called up by her superiors for poor performance. They were also surprised at her worsening condition, given that previously she was noted to be a highly motivated worker. Her close friends outside the workplace knew she was struggling in her new role as a single mother, while her family blamed her for the separation. Reluctantly, she visited a psychiatrist but reported to her workplace that she was sick with fever. However, the HR department called her aside and said it was okay for her to take time off for mental health treatment. She could fully return to work when she felt better. With appropriate therapy and the support she received at the workplace, within a few months, Miss SK did get better and returned to her old self. As a result, she was happy, her children were happy, and her company was happy. This is not an unusual story. In fact, 1 in 3 Malaysians will struggle with a mental health condition at any one time in their life. Within the workplace, the numbers are similar. Despite the prevalence, only 20% of people with mental health conditions actually seek professional help. That's why, for World Mental Health Day 2022, the Malaysian Mental Health Association has chosen the theme, Make Mental Health and Well-being a Priority at the Workplace. Without effective support, mental health disorders and conditions can affect a person's confidence and identity at work, their capacity to work productively, and the ease with which to retain or gain work. The mental health condition of one worker can impact not only his organization, but his colleagues, family, community, and society at large. On a national level, the cost of mental health issues in the workplace to the economy was conservatively estimated to be over 14 billion ringgit, or 1% of GDP. This may be a significantly higher figure by the year 2030 if mental health in working adults is not addressed. Despite the high economic costs, less than 1% of Malaysia's annual health budget is allocated for mental health services. But there has been a commitment to increase this figure. Still, there's only so much that can be done by the government. Organizations and companies too must play their part in protecting and promoting mental health at work and support people with mental health conditions to participate fully and equitably in work. All workers have the right to a safe and healthy environment. No doubt work is a protective factor for mental health, but it can also contribute to worsening mental health. The good news is work-related mental health conditions are largely preventable. Supporting and promoting employees' health and well-being creates a healthy workforce that translates to optimum efficiency, increased productivity, reduced absenteeism, and decreased employee turnover. Employees need to feel safe in order to be open about their mental health condition without fear of disciplinary action. Building this trust between business and staff will boost morale and resilience at the workplace. To take it one step further, companies can incorporate mental health awareness into the workplace, improve mental health literacy, and teaching the skills needed to safely and responsibly respond to a co-worker's mental health concerns. These suggestions would help reduce the stigma related to poor mental health. Top candidates are really looking for an employer who can offer them something more. So, be that organization that supports mental health at the workplace. Happy World Mental Health Day.